Here we have Maria in the prone position here. I'm going to show you a hip adjustment that I especially like. It's not right for everyone, of course, but nothing ever is right for everyone. But what I like to do here is put my hand on the PSIS and check the mobility, see how much mobility is in that PSIS. And if you've palpated your patient before and you're familiar with your patient's anatomy, this is just an extra step that you can take, because if you're doing this palpation and thinking about this adjustment, obviously they're reporting some kind of new problem in the hip joint meaning the femoral acetabular joint in this case. So because pain in that region often refers like crazy, and patients will often present with sort of vague symptoms, and sometimes even almost sciatica-like symptoms. And of course that's perfectly normal, but in this adjustment what I like to do is a little bit of external rotation here, and I'm going to use my elbow on the person's leg here to kind of stabilize it. I'll usually grasp my other wrist. I've got the ankle in the crook of my arm at my elbow, or even just a little bit higher. I place my elbow on the femur, and make sure that you're not separating muscles with your elbow. You want a nice broad oblique contact here, and grasping your own wrist automatically sort of provides that. And this adjustment is kind of a body drop along with a thrust, and it looks something like this. Now I find this one's extremely effective, and there are many variations on the theme. I might just cross the other way, grasp my wrist again, and again basically my shoulder here is stabilized, my humerus is stabilized, and I'm just going to bring in a little bit of traction and then thrust with a body drop. And of course I'm also pulling on her leg down here by her ankle. So now to train for this exercise, obviously in this case it's probably better to separate the different components of the exercise. So I've got the heaviest spring, the black spring in here. I've got a deep tissue pull, and the thrust itself is also going to be pretty deep. Of course, you're free to pick whatever parameter settings and margins for error that you like. But here basically I'm just going to stabilize the unit in my shoulder. I'm going to get my fencer stance here since I've got a table to lean on, and take my tissue pull and practice the thrust just like this. And then because there is a body drop component, if I've got a table handy, I'm going to take the same kind of stance. I've got the top of the Dynadjust unit almost in my armpit here, and I'm just going to practice a nice fencer stance, body drop thrust. And whenever we practice body drops, of course, the main objective is to try to get a clean, straight drop with no lateral movement, and also speed is as important with this one as it is with everything else. But with this one, probably the most difficult thing to do is to avoid loss of pre-manipulative tension. So we don't want to see this kind of thing. Don't want to ease up before the thrust. You got to take your tissue pull, calculate where you're at, and drop as fast as you possibly can. Now, extremity manipulation is an art in and of itself. A lot of chiropractors don't do it at all. I do it. I find it fascinating and so very beneficial to patients. It's not something they get just anywhere. Even a lot of physical therapists don't do a lot of manipulation of the extremity joints. So let's talk about manipulation of the hip joint, the femoral acetabular joint here. Now, as you all know, the femoral joint is a very, very deep ball and socket with a huge labrum, and it's a very stable joint in normal people, but it's easily damaged, especially if the patient's out of condition. But what usually is going on is a lot of muscle damage or tendon, ligament damage around the joint. And this can cause synovial invagination or entrapment of tiny pieces of cartilage that have been torn from the labrum and are being impinged. And so a lot of times just a simple little adjustment, just trying to separate the joint just a little bit to allow whatever might be trapped in there or impinged there to free itself up. Of course, you're rarely going to get a cavitation here. In some people you do, but in most people with normal anatomy, it's unlikely you're going to get a loud pop or anything like that. And of course, you also have to consider if you're going to be pulling on this leg here in order to separate the hip joint, you got to think about, well, can I use the knee? And if you know your patient well and have done a good examination and question and answer period with them, then you will find out usually that it's okay to incorporate the knee joint in with your thrust, of course. And a quick way to check the integrity of the tendons, of course, tendons and ligaments, is to check the lateral collateral ligament, the medial collateral ligament, check the tibial plane, maybe even do a little drawer sign there, just looking for anterior cruciate laxity. But anyway, if you're confident that it's okay to use the hip joint as part of your fulcrum, then what I will usually do is put one arm underneath the joint. I've got our ankle pretty much pushed against my body, maybe even up in my armpit, and then the other hand, I'm going to lock my hand on my wrist. This hand's going to be stabilizing the knee here, and I may do rotation in either direction. I might just do a series of little thrusts like so, then rotate just a little bit, always checking in with your patient to make sure she's doing all right. Maybe some internal rotation like so. So with this adjustment, the training with the Dynadjust is pretty obvious. You know, you're just going to be holding the unit with the base of the unit in your chest and pulling forward like so, and then changing your angle. And of course, right in this adjustment, you can think about what muscles are actually being used. And this is something that you can do either in the fencer stance, or really you can take any stance you want, because even though when we do this adjustment on a patient, we want to protect our own back and make sure that we're not endangering our backs. But to train for this exercise, to get really fast and not have to pull too much traction, instead we're using speed to increase the force that's being applied here. Exercising with the Dynadjust is very, very simple, and the superimpositions will help reveal what that's all about. Now, ankle adjusting is especially beneficial for people who need it. In my multidisciplinary practice, we actually have a podiatrist, but he chooses not to do manipulation of the ankle, and so he refers all those patients to the chiropractic side of the practice. But for the sake of demonstration here, what I usually do, depending on the problem, of course, is grasp the heel in one hand, place my piezoform contact right at the top of the ankle, or of the foot bone here, right where the tibia comes in, at that joint, and a little bit of distraction, and just a little thrust like so. I'm not necessarily looking to cavitate everything in here. Just again, usually probably trying to clear up any little synovial impingements, just like that. And of course, before we do this, we need to make sure that the knee and hip are stable.